فضلا الاشتراك في القناة وتفعيل زر الجرس وتشييره وعمل اللايكات.
To administer an enema using an enema bag, fill the bag with warm water from the faucet as prescribed. If saline has been ordered, warm the container of saline in a basin of water before you add it to the water in the enema bag. Then check the temperature of the solution by pouring a few drops on your wrist. The water should be warm but not hot. If a soap suds enema has been ordered, add Castile soap after the water is placed in the enema bag. Next, raise the bag, release the clamp, and let the solution flow just until it fills the tubing to push the air out of it. Then reclamp the tubing. When the enema and the patient have been prepared, you may apply a little more water-soluble gel to the pre-lubricated tip. Then gently separate the patient's buttocks and locate the anus. You can help him relax by reminding him to take deep, slow breaths through his mouth.
Can you take a few deep, slow breaths through your mouth?
Touch the skin next to the patient's anus with the tip of the rectal tube. Then gradually insert it into the anal canal, angling it toward the patient's umbilicus. As you would for a pre-packaged enema, adjust the insertion depth based on the patient's age, but don't force it. As you hold the tube in place, open the regulating clamp and allow the solution to enter. Keep the enema container at the level of the patient's hips to prevent the solution from flowing out of the bag too quickly. Gradually raise the container above the anus. For a high enema, raise it 12 to 18 inches, or 30 to 45 centimeters. For a regular enema, raise it 12 inches, or about 30 centimeters. And for a low enema, raise it 3 inches, or 7.5 centimeters. Once the flow of the fluid has been established, you may hang the enema bag from an IV pole. If the patient has cramping or if fluid escapes around the rectal tube, lower the container or close the clamp. When all the solution has been instilled, clamp the tube. Tell your patient that you've completed the procedure. Place toilet tissue around the tube at the anus and gently withdraw the rectal tube and tip. For either type of enema, explain that mild bloating and abdominal cramping afterward is normal.
وفي نهاية الفيديو فضلا الاشتراك في القناة وتفعيل زر الجرس وتشييره وعمل اللايكات، واكتبوا لي الفيديو الجديد حابين يبقى العنوان بتاعه ايه، واشوفكم على ألف خير والسلام عليكم ورحمة الله وبركاته.